I need to turn off my video. We're going around here. I think you still have it open, Mark.
Mic too, Grace Marie.
Yeah.
Welcome to EmpowerU, everyone. It's great to have you here tonight. Good to see so many people are signing on. I'm Dan Reganold. So EmpowerU, if you haven't ever been to one of our classes, is a series of free seminars meant to just help you become more empowered in your lives by helping teach you things, helping you enjoy your life and get more engaged in important topics like the ones we're going to be talking about tonight, like restarting the economy of Ohio and just the status of our crazy healthcare system in the United States of America. For those of you who are new tonight, who have never joined a session before, we're glad to have you here. And you can always go to EmpowerUOhio.org and find out about our current classes. So what I thought I wanted to do tonight, because we're not able to be in our class in Springdale, at our normal studio, I wanted to say hello to the EmpowerU team that's so helpful in making these classes possible. And that's Betty Overstreet, our executive director, Jill Google, our operations manager, Bill Roll, our treasurer, Jay, our producer, who's helping us out tonight, and Joe Platt, who's kind of our political guru. So what we like to normally do is we like to start the class with kind of an interesting article. And I think for the interesting article tonight that I want you to think about looking at on empoweruohio.org, there's a link to it. It's an article from our guest last Tuesday night, Robert Epstein. So last night, I don't know how many of you saw this on TV. I think Tucker Carlson must have been checking Dr. Epstein out last Tuesday when he was on EmpowerU. And what an interesting class that was. If you missed that, go to empoweruohio.org and watch the replay. It was incredible. But Dr. Epstein has published a new article on the Daily Caller, and I urge you to read it. And it's all about probably what our guest is going to be, one of the things our guest is going to be talking about, and that is the importance of testing. We also like to EmpowerU, like to start things off with a little bit of a giveaway. We have raffle tickets. We draw a prize and give something away. And so tonight, I'm going to try to ad lib on that and do something. If you scroll down your mouse to the bottom of your screen, you'll see something. Go all the way to the bottom, you'll see something that says Q&A. And what we're going to be doing is giving away a couple designer face masks. And this is yours truly with his mask on. And this is actually a product that I'm excited to say that our company Frame USA is going to start to manufacture 2 weeks from now. So if you'd like to have a designer face mask, if you'd like to win one, if you're tired of the white ones, just go down to the Q&A and put your email address in there. We'll pick out a couple winners and hopefully we'll let you know at the end of the class if you won. So I think it's a pretty good look. I don't know what you think. Give me your thoughts. But a couple other classes we've got coming up. Our resident expert on China, Al Tufarber, will be with us Thursday night. It's going to be a great class. He's a professor emeritus at University of Cincinnati. He's going to join us. He's just going to be talking about all the repercussions of China and what's going to go on with it. Oh my goodness, this is so much on the front burner. If you haven't seen Al speak, this is a class you really want to sign up to come to, and that'll be Thursday. We'll also have at the beginning of the class somebody who's very much of an expert in Hamilton County, and that is Barbara Holwadell. She'll be talking for a few minutes about the largest tax increase in the history of Hamilton County, and that will be issue 7. Barbara has taught me so much about issue 7 and really what it's all about. And really what it's about is the changing face of mass transit in Hamilton County, and really I think all the areas around Cincinnati based on Uber and Lyft revolutionizing the market. We've got a brand new class we've added for the 23rd of April. I'm sorry, the 21st of April. We've got Matt Miller-Novak. He's going to talk about the First Amendment. And boy, I think we'll get into that a little bit tonight. Matt's from the Godby Law Firm. He's really excited about talking to EmpowerU. And then 2 nights later on April 23rd, we'll have a familiar face, Greg Lawson from the Buckeye Institute. He's written a paper to talk about what is going to happen to Ohio's economy in the time of COVID-19, what we're going to have to cut, what it's going to mean for taxes. And Greg is always super interesting, super analytical and factual, and I think it's going to be a great class. I hope you'll join us. It's not up on the website yet. It will be within a couple days. Joining Greg will be Jonathan Deaver, who is the former District 28 House Rep from the Ohio House. John is an attorney. He's going to talk to us about a difficult subject, and that's about helping consumers and businesses in the face of just these terrible financial, emotional times. He's going to talk to you about what happens if you have to have a tough conversation about losing a home, fighting foreclosure, possibly losing your livelihood. This can be an important subject to a lot of people in these times. I hope you'll join John. If it doesn't apply to you, please tell somebody about it. We've talked the last couple classes about our Fill the Truck Initiative org to provide 7,500 boxes of personal care items to seniors. Geez, I would just love to have you help out with that if you were able. So I guess I've got to tell you, I've been thinking a lot about liberty in Ohio for the last couple weeks. And it wasn't really until today that I looked at what it says in the Ohio Constitution, but before our first guest comes on, I wanted you to know what it says in the Ohio Constitution, because maybe there was a time in the last couple of weeks or the last 3 weeks or 4 weeks when you said to yourself, don't I have a little bit of say here in terms of what's going on? I know being in business as long as I have, I thought that was kind of my ship to run, my way to fail, my path. I was charting the course, but this is what it says in the Ohio Constitution. And I'm not as smart in this as our guest is, or some of the many people that have taught me about the Ohio Constitution. There's so many great Ohioans who have done that over the last many years. But what it says is men are free and independent. They have certain inalienable rights, among those enjoying and defending life and liberty, acquiring, possessing, and protecting property, and seeking and obtaining happiness and safety. And then it also goes on to say, should there be an emergency declaration there must be a 2/3 vote by members elected to each branch of the General Assembly, and the reasons for such necessity shall be set forth in one section of the law, which section shall be passed upon a yea or a nay vote. When I looked at that, what I didn't see was the health director of the state of Ohio running my life for the next unknown amount of time, or the citizens of the state of Ohio. So that discussion thinking about liberty, I started seeing posts on Facebook from our guest tonight, Mike Wilson, about problems with the analytics of COVID-19. Mike and I have known each other for a long time. And it's amazing to me, it's an amazing fact that somehow I was drawn to Mike Wilson to talk about liberty and his new project, Restart Ohio, in the face of COVID-19. Mike is a Cincinnati native and proud graduate of St. Xavier High School and the University of Cincinnati. His degree is in applied mathematics, which has served him well as the CTO of Interlink Cloud Advisors, a local Microsoft consulting firm. And he analyzes data. Mike is a very data-driven guy. He's the guy to talk to us about this. Mike has stepped back from his recent political activism, but he founded the Cincinnati Tea Party in 2009, quickly built an organization that was really one of the most respected grassroots organizations in the country. Mike was also instrumental in leading the successful amendment to the Ohio Constitution with the Healthcare Freedom Amendment in 2011. We're just so pleased tonight to have Mike here to talk to us about his new initiative. Mike Wilson.
All right, awesome. Dan, thank you so much for the opportunity to be with everybody here tonight, even if it is only virtually. So I want to tell you a little bit about restartohio.com, but I also want to give you a little bit of the case so that we understand kind of where we're at, where we're going, and we're looking at the data to go through and figure that stuff out. So the presentations, the analytics of COVID-19, I understand there's going to be questions. Feel free to go through and put those in the Q&A. Dan's going to collect those for me and ultimately feed those back to me kind of when we have those. So as we get started on this one, I'm apologizing for you. If they told you there wasn't going to be math, there's going to be some math. There's no getting around that one, unfortunately. But I'm going to do the best that I can to make it as interesting and engaging and easy to understand as possible. Probably not as easy as my favorite all-time mathematician, the former Winnie from the Wonder Years, Donica McKellar, who's a PhD in mathematics. But I'm going to go through and do my best. So let's jump right in here and let's talk about models, because that's what everybody's talking about today. How did the models get this so wrong? Why are they so far off? And so the answer is a lot of reasons here, but I collected some of the various models and the various dates that these were announced just to go through and set the table for the conversation tonight. So the one that was the big driver of, well, wow, we've got to go through and do something right away is the Imperial College model, right? This is the one that Niall Ferguson out of the UK, forecasted that there would be 2.2 million deaths in the United States, right? Now, the media reported it that way. They didn't tell you that there were various mitigation measures built into this model and that they tried to model out what would happen if we actually reacted to it. So the 2.2 million is if every single human being in the United States didn't react and didn't change anything with people dropping like flies around them, right? We'd have 2.2 million die. Now, if we put strong mitigation measures in place, very similar to what we have today, the expectation was 192,000. So we're a lot closer than we were at that point. The first time that we saw a decision maker in the United States actually could talk about the number of potential deaths were Drs. Fauci and Birx on March 31st in their briefing with President Trump, where they cited a number of different models and forecasted a range of 100,000 to 240,000. Now, those models that I talked about, Imperial College and the ones that Dr. Fauci and Dr. Birx were citing as part of that are dynamic epidemiological models. So that means that they're looking at the factors of a given disease, they're looking at the factors of a population, and they're doing their best to project how many people are ultimately going to get and then die from the virus. All right, so they're a little bit different than the model from the IHME. So this is the one out of Washington State that's, may have heard has been funded by the Bill Gates Foundation as part of that. But this is the one that's been a little bit more realistic, even though these numbers change pretty frequently over time. So the number of deaths in the United States have ranged from 93,000 on April 2nd down to 68,000 as of the update when I put this presentation together yesterday. All right, so why do these models change, right? Before I get to that, I want to give you just a little bit of a sanity check. Right, so when I heard that 2.2 million number, I about fell out of my chair. And so, as I'm trying to figure out, is all of the hubbub that we're hearing about this legitimate or not? Now, I'm not an expert on an infectious disease, but there's a lot of data out there on the internet. So I started digging and I found the Diamond Princess example. All right, so this is interesting. So there's a lot of controversy over just how easy this is to go through and infect other people. There's a lot of controversy over just how deadly this virus actually is. And part of the problem is that we don't know yet. It's still very early within this outbreak. We don't have the ability to test large quantities of people. And even if we did, there's a lot of people that just aren't sick that would never get picked up by that system. So we really don't know. All right, the one example that we have where a large population was basically entirely tested was a Diamond Princess cruise ship. So this is one that ended up having an outbreak on the ship, and so they were quarantined off the coast of Japan for about 2 weeks. Right, so 3,700 people were on the boat. Nearly all of them ended up being tested for the virus. Of those, 634 became infected over that 2-week period, 17% of the total population. Now that being said, we do understand part of the crew. So we've got a pretty wide mix, but probably a little bit more elderly than average. All right, 7 people died while on the ship, and a study that I read said that they expected other people to die after they got off the ship. They weren't able to go through and track that. So it's probably a little bit north of 1.1% for the death rate on that ship. So if you take those numbers, I just put together a few simple scenarios just to go through and take a look at this and say, are we even in the ballpark with some of these estimates? So if I take that 17% infection rate and I multiply it times 330 million people, and then 1% of those people unfortunately pass away, we're talking over 500,000 deaths in the United States. Now, given a typical flu season is somewhere in the neighborhood of 80 to 100,000, we're talking about something 5 times as deadly as a baseline as the flu. That was enough to get my attention. Right now, we have other scenarios we can look at. Maybe it ends up being more infectious. Maybe we ends up being less infectious. Maybe our death rate, is actually lower because there's a lot of asymptomatic carriers, right? But just doing a little bit of sanity check on the numbers gave me something somewhere between 16 million and 82,000. Enormous ranges. I think based on the trends that we've seen right now, we're probably at the lower end of those ranges. But I do want to tell you a little bit why. So how did the models get it so wrong? So problem one. The initial models were heavily based on data from China, right? So as we have found out since, China lies, right? China lies, China lies, all right? So the data that we got out of China around the initial outbreak was not reliable even a little bit. All right, the second country that had a large outbreak was Italy. And again, Italy has some things that are very unique to their population. They're very old, compared to the United States. They have a lot of smokers, a lot of people that are sick otherwise. And again, since Italy was kind of the second outbreak, a lot of that data was kind of baked into our models. So it took some time to go back and look at this and find out where that was wrong. Second thing, exponential growth models, right? So when we have things that are doubling every 2 or 3 days, they're really sensitive to the starting assumptions, right? So at this point, we don't know the universe of potential hosts. We assume it's pretty much everybody because this is what's called a novel virus. It means that it's new, and so we shouldn't have any built-in immunity. That also assumes that this hasn't been circulating in the wild longer than we thought. Which again is very much up for debate right now. The rate of transmission matters a bit. If one person can infect 3 people, it's a very different virus than if one person can infect 1.5 people. And like I said before, we don't know the true death rate because we don't know how many people are actually sick with the virus. We're just doing our best to estimate based on the information that we have. And the last part is they don't understand the impact of the mitigation measures. So even if we did nothing, I guarantee you that human beings are going to look at the environment around them. They're going to start being a little bit more cautious. They're going to start washing their hands. We don't always have to have government come in and tell us, here's what you have to do to avoid an outbreak. People will protect the elderly members of their family and take those steps, okay, without anybody telling them what to do. All right, so let's talk a little bit about Ohio for a minute. So I apologize that this is distorted a little bit here. I couldn't find a good version of this, but I think it was important for me to go ahead and show this because this was the first set of projections in the state of Ohio. This was put out on March 28th, and that showed that in Ohio, and this is the operational model put out by Ohio State University that Ohio Governor DeWine and Dr. Acton, the health director, are using to drive decisions. They projected 62,000 cases per day if we didn't take mitigation steps. That's a big deal. Right? They also projected, even if we did take those mitigation steps, 10,000 cases per day, right? As you know by now, we're not anywhere near that. So over time, they have revised the model, right? And so here's the more recent version as of April 5th. We were projected to, it actually says 2,000, it's closer to 1,600 new cases per day on April 18th. And again, as we've gone through, as we get closer and closer to that day, it becomes more and more clear we are not on that trajectory and it's not even going to be close. All right. We continue kind of our tour through what's going on here in Ohio. This is a sample of the Ohio COVID-19 dashboard put out by the state of Ohio. And it kind of summarizes some of the key metrics. And I've got a few things here that I want to point out. So as of today, 7,280 cases have been diagnosed around the state. Of those, 7,153 had a lab test. So that means that we actually went through, got them tested, and confirmed they were diagnosed officially with COVID-19. Over the period of time, they have put out a mechanism to go through and identify probable cases. So they use clinical parameters of the infection to go through and identify potential people that had it but didn't get tested for whatever reason, 127 of those. So what this tells me is that we're doing a good job of testing the people that are the sickest. We're not necessarily doing a good job of testing people beyond that. There is still a testing bottleneck in the state of Ohio. So that means that when we go through and we look at the death counts, right, we see 324 people have passed away in Ohio, unfortunately, due to the virus. Okay, we're hovering just over 4% in terms of death rate. That's higher than I think a lot of the more reasonable estimates say, and a lot of that has to do with the fact that we're just not testing marginal people. If you had a cold or you were reasonably sick and you think you might have had it, there's a good chance that you didn't get tested in the state of Ohio at this point.
Mike, could I ask you a question on that?
Yeah, absolutely.
If there's 7,280 cases, what is there any expectation of how many cases there really are?
I think that's going to be really difficult for us to know that. I mean, in the end, I think where we're going to have to go with that one is we're going to have to see the expansion of antibody testing, which can tell if someone, potentially if they're infected, but more likely if they've been infected at any moment in time. And so, the actual number, and we heard, Dr. Acton bat around 100,000. I think that number is ridiculous, but I've heard estimates anywhere from 30% of infected people are asymptomatic or have very mild symptoms. And we'll just quarantine at home, to as much as 80%. And so if you do the math, kind of on those, 80% would mean we have, another 28,000, 29,000 people in Ohio that are infected, right? So maybe 35,000 total.
Which would put that death count down to somewhere around maybe like 1% or something.
Yeah, right around 1%, which I think is pretty reasonable based on, what we're seeing in other countries and things like that have more expanded testing. But great question. The other thing that's interesting as we look at this, 67,000 people, just under 68,000 have been tested in the state of Ohio. That means that right around just over 10% are actually testing positive. So even though we have a shortage of testing, we're still testing a lot of people that end up having something else, right? So that means almost 90% of the people that are being tested said, no, you don't have coronavirus and COVID-19 right now. And the last piece that's interesting, 1,500 healthcare workers have been infected. So there were a lot of reports that, again, because our hospitals and Dr. Acton, and they weren't looking at good models to make good decisions, a lot of our hospitals and Dr. Acton and Governor DeWine were expecting a surge in cases that hasn't materialized. So the personal protective gear that they had in hospitals, they were rationing pretty tightly and holding on to it. So even though we had sufficient for kind of the early part of the outbreak, we weren't giving all of our medical professionals the gear that they needed, and that sucks. And that's why the importance of data to go through and drive some of these decisions is super important, because we could have prevented a lot of those people, likely could have prevented a lot of those people from getting infected. All right, so as we break down the number of cases kind of by age, you may have heard that the number of people, that the older you are, the more likely you are to get sick and the more likely the virus to be deadly. We're definitely finding that true to be in Ohio, right? So you can see here that, almost half of the deaths, are counted by people that are 80 plus. And 24% are 70 to 79. So we definitely see that difference, but it's not enough to just look at those numbers in isolation. So let's actually take those numbers and figure out where it is based on population. So it makes it even more pronounced, right? So again, 80 plus population in Ohio comprised 4% of our population, 49% of our deaths. It's 45% excess on that. That is an enormous difference. So as we go through and we look at these numbers, it becomes pretty clear. If you're young, okay, you are not at risk for dying for coronavirus. And even those handful of cases that we see for 39 and under, those are people that had other underlying medical conditions that made them vulnerable, but you are far safer, with coronavirus than you would be versus the flu. But the inverse is the case for the elderly. If you are elderly, you are far more at risk for this than a traditional flu. And so that has, again, implications for how we go through and protect, the people that are most at risk within the environment. And then lastly, just to kind of go off and show the death rate, in the example there. So if we divide by the number of people that have the disease, so essentially if you are 80 plus and you get infected, you've got almost a 23% chance of passing away at this point. Right now, again, I understand that at the low end of the scale, you're probably not getting tested because you're not very sick. So take those numbers with a grain of salt. I think for the people that are older, we're probably getting the vast majority of those. But either way, your risk is very high if you end up being on the elderly end of the scale.
Hey, Mike, one of our
Yeah.
people online wants to know, where are you getting most of your data at in case they want to start checking those sources? Is it from the Ohio side or where?
Yeah, so some of the models have been from actually the sources for those particular models. All of the Ohio data has come from the Ohio Department of Health dashboard at coronavirus.ohio.gov. Some of the data I've actually captured on a daily basis. They don't show some of the time series, so I've had to grab that over time and kind of track it up my own. So, but if you go to restartohio.com, there is a link on that site that can actually get you to the raw data that I've been capturing during this time.
And one other question
Yeah.
before we get going too far. One of our attendees wants to know, are the total hospitalizations of those who entered the hospitals, is this number net of those discharged or died, or only those entering the hospital?
Yeah, that is a fantastic question, and I appreciate that one being asked. That was actually on my notes that I wanted to point out. The numbers here are cumulative, right? And one of the things that, I think Ohio's actually done a fairly good job at trying to be transparent about data. It's actually been quite good that I've been able to do a lot of this analysis, but they haven't done a good job of saying what cases have been resolved. So we don't know how many people have gotten better at this point. We don't know how many people are currently in the hospital or the number of people that are currently in the ICU. I heard that I think Dr. Acton mentioned something like 800 were currently in the hospital today. But again, that's kind of secondhand on Facebook. So, don't take that one to the bank on that one.
Thank you.
Okay, so when we start to look at where we're going, we've got to look at trends over time. And this is where, I've had to gather some of this data on my own. And I started doing this on April 1st. And so I've gathered kind of updates to the data set every day. And they do show some historical data for us as well. But this is a graph of the number of COVID-19 deaths by the day that the death occurred. So the actual date of death. So we can see that we had our first death in the state on March 14th. The second one came on March 17th, and they've slowly been increasing over time. We hit the peak here on, right around April 6th, 7th, 8th, right through there. It's pretty flat. But it's difficult to go through and extrapolate much from this. The first is that there's a little bit of a reporting lag, so we won't see all of that data immediately. So I expect this to get updated over time. And two, in the end, all right, we know that if the death rate is 100, essentially 100 people, or excuse me, 1%, or in this case, we'll say 4% of the people that we're testing right now. We know that if we can go back and say 100 people were infected on a given day, about 2 weeks later, because this virus takes time to kill, that we expect 4 people to die, right, as part of that. So in the end, I call you're looking at this graph of the deaths, this is a lagging indicator, okay, that will follow the leading indicator of the number of cases. That's really where I wanted to focus, where we're going from a direction standpoint. So the next graph is the one that you've probably seen on TV or in the newspaper or on the internet, and this is the graph of COVID-19 cases based on the date reported. So this is, the daily total that we announce every single day. Today, was the date that we had 272 released. You can see that big decline there at the very right as we drop down to our lowest day since March 31st. That's fantastic news. But even this doesn't give us a great view, right? We can see here that we reached a peak. We had that kind of that 5-day moving average. That peak occurred right around April 5th. But what I can tell you here is if we look at the underlying data, and this is where the magic starts to happen, I can tell you that we were heading downwards way earlier based on that. So now let's look at the data first infection. All right, this is based on the clinical history. So someone gets sick, they get a positive test, Ohio goes back and says, here's when we think they got sick initially, right? And so on this one, we can see that our peak occurred even earlier, right? So we were pretty much flat from March 27th on, had a very small peak right around April 3rd and April 4th. Right, so pretty early on, we had seen this start to level off. And so it was only a matter of time before the new cases reported every day caught up to it. Right, and so when Dr. Acton was out there saying, hey, we have a surge on the way, we're expecting 1,600 cases per day, I could call BS on this as early as March 31st. Right, and here's why. This is the growth rate in new infections, right? So what I'm looking at here, right, is growth rate over 2 weeks. So if you want to interpret this graph, on March 23rd, we can say that over the previous 2 weeks, we had 17 more new cases each day. right? So we kind of increased from somewhere around, 20 to 30 new cases today to about 250 cases per day over that 2-week period of time. So we could say that we were increasing. After that, the rate of growth has gone down, and we can see we got below 0 on April 7th. And so each day since then, on average, we're actually seeing cases go down over that period of time, which is fantastic news. And again, this is where it gets math heavy, so I apologize, right? For those of you that took high school calculus, you may have heard a term called the derivative. The derivative is a way that in math, we go through and we measure, is that growth rate increasing or decreasing? So if this is above 0, that means the growth rate is increasing. If it's below 0, is that rate of growth decreasing? All right, and so what's interesting here is we can go back and look at this, okay, in conjunction to whether when we actually put some of the mitigation measures in place in the state of Ohio. So what we can see is that on March 15th, we were pressing the accelerator pretty hard, right? That was the day that we were pressing the accelerator the hardest, the rate of growth was the highest, all right? That also coincidentally was the day that restaurants closed. All right, we can see that we start letting off the accelerator over the next few days. On March 16th, schools close. We go to working and doing schools remote, all of the recreation stuff. So bowling alleys, golf, Top Golf, Dave & Buster's, all that kind of fun stuff gets closed. All right, look at the trajectory here as we close the hair salons now on March 18th. All right, we had already by March 18th and 19th started to put the brakes on this. Right, so there's still a lot of momentum in those new cases, but we had already started to slow down. So again, when I'm looking at the data on March 31st, I can see this trend just through March 31st, and it was obvious to me that this was not spiraling out of control. Right, so the other stuff that we did, March 23rd, we closed non-essential businesses, basically no impact. I will tell you, we did have a little bump here where the growth rate does start to pick up just a little bit. My best guess is that that's actually medical personnel getting infected. I wish I'd gone back and tracked that historically, but my guess is that we had a little outbreak of medical personnel that were on the front lines. But again, even though we went through and did kind of the limits to the number of people in retail stores on April 2nd, you really didn't see that didn't affect the long-term trend of that being downward. And this, my friends, right here is the magic of math. Right, we were able to go through and look at the data publicly released by the Ohio Department of Health and see that we already had this under control and we're trending in the right direction long before the powers that be got caught up. And so that's, if we start to look at some conclusions that we can draw from this, right, first, I think this is a deadly disease, right, that we need to keep a close eye on here, that we need to be able to manage. Right, there's no indications we're going to be able to eradicate this, but it is obvious that we're going to be able to control it. And it is under control right now, but we have to understand there is an enormous economic and human cost associated with the mitigation measures that we have in place right now. It was obvious that we were approaching a peak as early as March 31st and April 1st, because of some of the math that we showed, and we see that the models have been wrong pretty consistently. So the bottom line, in my view, it means we need to restart Ohio now, not tomorrow, not May 1st, not after that. Okay, we have this under control and we need to restart it now, but that still means safely and gradually. And we've got the data right here that we can watch to make sure that we're doing things the right way. We can judge the impact of our actions. And if you agree, if I've convinced you today as part of the presentation, love to have you visit restartohio.com and sign the petition. So with that, I'll kind of wrap up and open it up to any questions that you might have. And again, don't forget, if you agree, visit restartohio.com and sign the petition and spread that to your friends, family, and neighbors.
Thanks, Mike. That was a great presentation, except you kind of were bringing back some bad memories of the derivatives going back to high school. But I've got several. It's astonishing, really, when you look at the data and you see what people have gone through over the last 3 to 4 weeks. When you look at it, thanks for pointing that out. So I've got a few questions that people have asked, and if you've got questions, go down to put your mouse at the bottom of the screen to the Q&A button and ask questions. Jerry wanted to know how accurate do you feel like the testing is in Ohio?
I think that the testing is pretty accurate. We're just not doing enough of it right now, right? Part of the problem that we have is that we have a testing bottleneck, not just in the state, but otherwise. And a lot of the nationwide testing has been prioritized to the places that are hotspots, so they're not really sending stuff to Ohio right now.
Mike, I just don't get the whole testing thing. I mean, they've been telling us for weeks it was going to get better. And this doesn't seem like that. It doesn't seem like rocket science unless they're out of some raw material for the testing or something. Do you have any sense on why they can't get this done?
Yeah, there were some of the reagents for one of the early testing modules that actually there was a nationwide shortage of that. So that was a big part of the bottleneck. Abbott Labs has rolled out some newer stuff. And so I know that test was supposed to be more ubiquitous. I'm not sure if that's being used at velocity right now, but that's definitely a place where we're looking to see more ramp up and the ability to go through and test.
How about Karen wanted to know, are the deaths actually coming from COVID with COVID, i.e. underlying issues that contributed
Yep.
to the risk then death?
Yeah, I think all of these we can say that it is with COVID. To some extent here, it can be really hard to go through and, identify what an actual cause of death was. When someone dies of cancer, we often attribute it to the cancer, but most of the time it's something else, whether it's a particular organ failure or something else that ultimately gets them, even if that cascading failure was caused by the cancer itself. And so COVID-19, works a lot that way. In my view, I don't think we should focus too much on that. There's definitely a lot of noise in that data, and other countries report that very differently than we do. I've not seen any indication that people are trying to go through and game this so it looks more deadly than it is.
Michael asked the question, could be 10 to 14 day incubation period, March 15th plus 14th is equal to March 29th.
Yeah, no doubt about it. There's definitely lag in some of that stuff, and that's why even though we had taken steps, the fact that the derivative went negative, we would see that before the actual growth rate flipped, right? So you look at it took about 14 days, okay, to go from March 15th to March 29th when it actually flipped the negative.
My friend Barbara wants to know, can you explain exactly what it means to restart the economy? How would we do that?
So obviously we've got more data on the website, but a lot of it has to do with looking at how and when we relax restrictions, right? So I think, at this point we've learned that masks are very helpful, right? So yeah, they do a great job at, they do an okay job at protecting the wearer from getting sick, but they do a great job of protecting the wearer from spreading to other people, right? So being able to do ubiquitous mask wearing, fantastic. If you can work from home, okay, let people continue to work from home. But again, people can practice good hygiene. We can start to open things back up slowly and then watch the effect. The number one thing that I would do right now is start with, looking at right now, our hospitals are actually pretty slow, right? We've stopped doing elective procedures in order to go through and prepare for the surge that never materialized. And that's another example of the human cost of getting this stuff wrong. There are people that are out there that are hurting right now that are delaying, what are considered to be elective procedures, right? And we've got hospital beds that are sitting there unused.
It's crazy.
Right? And
Listen,
in the end, yeah.
Michael asked an interesting question, one I hadn't thought about. Would you consider relaxing restrictions first on low infection counties?
Yeah. I think one size fits all on this one, is going to be very, very difficult. Just like you've got different conditions in Ohio versus New York City versus New Orleans versus California, you've got the same thing in, Ohio, right? So you still have 2 counties in the state that have 0 infections, which is amazing to me, right? Considering we're almost a month into this. And so I think, again, the more that we can push this down to local control, as long as we've got solid data to make those decisions, I'm fine with having, different levels of restrictions at different places to help control the outbreak.
And Karen wants to know from Montford Heights, what numbers would cause you to again put the brakes on restarting the economy?
Yeah, we've got to watch the derivative, right? That's what tells us the impact of our measures, right? So if that derivative is above 0, we know that we're starting to see an uptick. If the derivative is below 0, we know that we're continuing to suppress the virus. I mean, the thing is, I understand, and I hate to say this, and I don't want to sound callous because every death is a tragedy, right? But, just like the flu, this is something that's going to be with us, and it's going to work its way through the population. Right, it's important to flatten the curve so we don't overwhelm our hospitals. But the goal, we're past the time where we have the ability to go through and eradicate this virus. It's something we're going to have to be able to manage long term.
Will you be updating the derivative chart on restartohio.com, Mike?
Yeah, we just threw this together over the weekend when we saw that the conversation really hasn't changed in the state. Understand there's a lot of state representatives right now that are questioning what's going on. They don't have solid data to be able to kind of communicate with the governor and express their preferences, and they really don't know how much support they have out there in the general population. That's why this effort was created. So we're going to continue to put information out there along with my partner, Dr. Robert Bullis, is kind of the medical advisor on that. And again, the goal is to make sure that our representatives know that there's a groundswell of people here that need to do this. And I got to tell you, we already saw protests starting at the State House last week. If people look at their own eyes and they see what's under control right now, if we don't start opening up soon, people are going to stop paying attention. right? We need a plan. We need transparency to keep people on board with this.
Why isn't the state legislature getting involved? Why are they pretending like they don't have anything to do with this?
They don't control the data. They don't control the models. They don't have the authority, right? I mean, in the end, they have a lot of ability to push back, right? But most of the options to do that are pretty strong, right? So taking a censure option or looking at things like impeachment, I don't think anybody's ready to take that step. Again, especially not without the population behind them. And so, if we let people know, hey, here's where we're at, here's why this is important, here's how this is hurting my family, you give them that support to go take a stronger stance and, versus the governor on this one.
So is it your position then? I just want to make sure I get your position right. And I encourage everyone to go on restartohio.com. I think Mr. McCabe did a great job on the site, and it's super simple and very, very, very easy to read. Is it your position that if somebody owns a business in Ohio and they've got a safety plan put together and they feel like they can protect their employees from this breaking out, that if they take that safety plan to the health commissioner, that they should be able to reopen their business?
I'll give you my opinion on that one, but I'd encourage you to ask that one of Grace Marie coming up next. Given she's got a little bit more of a medical background than me, but I think the answer is yes. And I said this to Brian Thomas this morning on 55 KRC. This is, Americans are resourceful people, right? We get it. We understand this is a problem. We already started taking the steps to go through and mitigate, right? People are doing things with their business right now to go through and continue to be effective. Americans will innovate their way around this. We just need to give them the opportunity to go do that.
Mike Wilson, thank you for joining EmpowerU tonight. It's so important to get a voice out there for all the people that are really going through economic calamity in their lives. It's just not right when you look at the chart, when you look at the numbers. And Mike, I'm going to ask you, I don't know if you've got the ability, we've still got a few questions. I don't know if you have the ability to go on at the bottom and keep answering those while we go on to our next speaker, but I want to thank you for joining EmpowerU, and we look forward to seeing the results of your continued work. Thank you very much.
Thank you so much. I wanted to hear what Grace Marie had to say, so I'm planning to stick around. So
excellent. Thank you very much. So we're going to just continue our discussion about healthcare tonight, and we've got another great guest with us, and that would be Grace Marie Turner, who is with us tonight, and she is the president of the Galen Institute, which is a public policy research organization she founded in 1995 to promote an informed debate over ideas to transfer. Let me just get my share button. I'm sorry. I'm still thinking about Mike and just didn't do that. But she has served us on the Long-Term Care Commission, the National Advisory Board for the Agency for Healthcare Research and Quality, and the Medicaid Commission. She testifies regularly before Congress and is published in hundreds of newspapers, including the Wall Street Journal, the New York Times, USA Today. She edited Empowering Healthcare Consumers Through Tax Reform and has contributed to numerous other books. She speaks extensively in the US and abroad, including Harvard University, the London School of Economics, Oxford, and the Gregorian University at the Vatican. She received the 2007 Outstanding Achievement Award for Promotion of Consumer-Driven Healthcare from a Consumer World. We're just very fortunate enough to keep up our discussion of healthcare and welcome Grace Marie Turner tonight to join us. Grace Marie.
Dan, thank you so much, and lovely to be with you all. And Mike, I want to clone you. If we had a Mike Wilson in every state, I think we would be able to open this economy so much faster. The amount of data, the data dive you've taken, really helping to use the information that we know to help public policy decisions is just incredibly important. I think Ohio really can be a leader in showing the rest of the country how to make all this happen. So it was a fabulous presentation. And I will start by saying that I'm not a physician. I'm a public policy analyst, more on sort of the economic side of things, but I think that your deep dive into the data would be useful for anybody making decisions. So I want to talk a little bit about kind of where we are, where some of the public policy decisions are that are being made, and what some of the implications for those might be, the larger impact on both our economy, and what this may mean for some of the policy conversations going forward. So first of all, Mike's absolutely right. Dan's absolutely right. This has just been devastating, especially for people who have businesses, that small businesses where they put their life savings into building businesses, building these companies. They care about their employees. Physicians' practices, many of them are worried that if this goes on much longer, they are not going to be able to open their doors. So we have to have a path to begin to open the economy. And you're starting to see already that some states on the West Coast and the East Coast are beginning to work on how they can make this happen. There is not a switch that we can turn to just say, okay, let's go back to the way it was before. A recent poll showed that 75%, 3/4 of the American people are worried about ending the social distancing. So does that mean they're going to go back to the restaurants? They're going to go back to their hairdresser and their nail salons and all of the other day-to-day activities, their churches, in order to be able to get the economy moving back the way it was. So people need assurances. And the reason that I think we start to see an incredible focus on testing, treatments, vaccines, is because people need assurances that they're going to be able to have the certainty that if they were to get sick, there are treatments. That if this virus comes back in the fall, which many people are worried that once we get down to the sort of the valley over the summer, the virus is much less responsive. The cold weather actually is much more conducive to the virus being transmitted and surviving. And once we get back to having in the fall, when it starts to come back, people need something to keep us from having to go through this again if we open the economy. Testing is going to be crucial. And I know there was a question about that earlier. I actually got a virtual briefing this morning from somebody who's really very much in touch with the laboratories doing this testing. As we know, we want to make sure if people think they need this test, that the cost of it is not a barrier to getting that test. And so testing is free. But that really is basically an unfunded mandate on the clinical laboratory industry, which, by the way, has a lot of the same experiences as hospitals. They're not doing the regular testing that they're doing, the blood tests, the other sort of normal run of testing. So the labs are having to lay off people because they are, and then the lab tests for the coronavirus isn't the same volume that they had before, just as hospitals are having surgery centers closed and empty. They're having to lay off workers because there are no patients. The stroke patients, the heart attack patients are not coming to the hospital. People are not getting their orthopedic surgery, their cardiac tests, etc. So we've got to begin to think about how we integrate all of these systems into something that gives people the assurance that that in the fall, if we begin to open the economy, that they're safe to go out. And testing really is crucial. I think we're going to start to see employers that are saying, if you want to come back to work, you have to get tested. Maybe even wearing some kind of a wristband to show that they have been tested. Social distancing in the workplace. All these companies that went to open workplaces, I think, are probably now rethinking whether that was really such a good idea. We've got to figure out how to do serology tests. So many people, and I'm sure you've talked to many of them too, have said, you know, I think I had that. I think I had that back in October, in November, December. And they need to know so that they can know if they have these immunologies. Again, I'm not a physician, but from everything I've read indicates that the structure of this virus is actually relatively stable. And it is unlikely to mutate as rapidly as it would need to in order for people to not be immune if they've already had it. So having had it is very likely going to mean that you're protected from getting it again. So employers are going to need to start testing. Businesses are going to need to start figuring out how they can reconfigure their restaurants. You know, some of them barely make it filling every table. every night. So how are they going to be able to do that and still keep social distancing? Are people going to continue to take food out? Are open air restaurants going to be easier for restaurants to be able to have people come and maybe be a little closer together? So I want to show you a couple of slides here. I'm going to do my share screen to show you the difference that it makes of what happens with public policy. Mike mentioned Dr. Epstein being on TV last night about talking about the importance of testing. My colleague, Doug Badger, who's one of the senior fellows at the Gale Institute, co-wrote a paper with Bob Moffett that I really recommend that you find. It's on the Heritage website, Defeating COVID-19, What Policymakers Can Do to Change Conditions on the Ground.
Great,
And
Sanity. We'll put that up on
great.
EmpowerU.org tomorrow. Thanks.
What they look at is, what are the powers of the federal government? What are the powers of the states? And what can we learn from other things that other countries have done to see what might be the right public policy approaches? And so they looked at Italy and South Korea as two examples of very different approaches to this virus. Italy it had a very huge early hotspot in the northern part of the country. Ironically, in order to be able to have the label made in Italy, there is a large enclave of workers from China that have moved to northern Italy in order to be able to basically produce things at at prices that are more like made in China, but with the made in Italy label. Well, what did they do? They went home for the Lunar New Year. They came back and we saw this huge spike in northern Italy. They really were not prepared for this. And so what did they do? Social mitigation. Stay off the streets. You've probably seen the YouTube videos with mayors literally going into the streets and yelling at people to get back into their houses. Well, in Italy, not only is it an older population, lots of smokers, as Mike said, but many generations may live in the same home. And so if you're telling people they have to go home, then if one person is infected, they are likely to infect the whole rest of the family. Plus, the Italian healthcare system is very much of a government-run healthcare system, and they are basically operating at maximum capacity all the time. And when they have this huge surge, they simply don't have the capacity to deal with that. So mitigation, stay at home, confining people together, and then if you're sick, you go to the hospital, which have become basically breeding grounds for further spreads of the virus. South Korea, in contrast, has relied a lot on testing, early testing, finding out who's been infected, who's infected now, and rather than closing down all the businesses, all the shops, shutting down their economy, they have said, if you are infected, you need to be separated out from the rest of your family even and other workers so that you are not spreading this disease. So they have basically isolation centers. I believe they're voluntary, but people go there because basically you're going to have everybody together that is that's infected until they are well and can be able to get back into to the workforce or go back home. But so basically keeping people who are infected away from the rest of the population, knowing who they are, allows you to be able to have your economy more open. Now, we saw in the last couple of days that I think Google and Amazon, Google and one other company, have come up with a way to do, Google and Apple, to do contact tracing. Now, I think that as the libertarians among us may have some problems with that. And what is that going to mean for our civil liberties? And we're going to need to have that debate. But that's basically how the public health system works. They find out who's infected, and then they go back and try to find out everybody else that they've been talking to or that they've had some interaction with. And so that's the principle that public health has worked on for more than a century, but they want to try to do this electronically. That's one of the things South Korea is doing. So you can just see the very big difference in those two public policy approaches to, and I don't know how to unshare the screen. So let me see if I can do this. Cancel, no. So you can probably see if I'm struggling here.
You're fine. You're fine.
Is it okay?
Yeah.
So can you just unshare my screen, or do I need to do that?
Yeah, we'll do that.
Okay.
Good.
Okay. So I'm afraid I don't want to press any more buttons for fear I will disconnect Zoom. So I'm just gonna look at you. So so where are we? Congress is just throwing money out the window, right? Trying to figure out how to save our economy, how to try to figure out what we need to do. There have been a lot of important lessons, I think, from this. One is the private sector is agile. It's got huge capacity. It can even a big company like Ford Motor Company or GM can turn on a dime to stop making cars and start making ventilators. So you've seen a lot of repurposing in the private sector to be able to be responsive to this virus. Some people have said that they haven't seen a mobilization like this since World War II, with the private sector really engaging in this battle. Where there have been slip-ups, it's very often been government programs. The CDC, the Centers for Disease Control, said at the beginning, we're going to figure out the test for the coronavirus. Well, the end of February, they still were saying, this test is flawed, we need the private sector's help. Fortunately, labs and other companies in the private sector were already developing tests because they knew this was going to be needed. And so literally within days of CDC saying, okay, bring on your tests, we started to see tests that were available. So that's one of the reasons that there have been, that we lagged in the testing, even though the president shut down flights from China wisely the end of January. We lost time in February in really being able to massively ramp up our testing capability. We are not anywhere close to what we're going to need for testing. And laboratories are being told, you have to provide this test for free, but yet they're not getting supported financially to do this. Not only some of them are losing money on every test, yet they're being told, you need to ramp up your capacity to be able to meet the huge new demand of all the people that are going to be going back to work, and we need to make sure that we know that they are safe and that they're being tested. So I think there's an important lesson here. Obviously, the pharmaceutical industry has been ramping up like crazy. Vaccines, treatments, everybody wants to be first. It very likely is going to be that there are several different treatments, but these trials take a very long time. The FDA is doing everything it can to really try to expedite the trials, the clinical trials, but they need to make sure the vaccines are safe. It may be that there's more than one that are approved, but there have been examples in the past where a vaccine actually got people more sick. So we have to make sure it's safe because this is going to be so massively used. The companies are already starting to figure out how to ramp up their manufacturing capability to be able to have enough vaccines so that by the fall we can inoculate literally millions of people. So even though there isn't a vaccine yet, they're already thinking about the manufacturing capability. So I think the real heroes in this is going to be the private sector. the grocery stores, the Walmarts that kept themselves open, the pharmaceutical companies, the supply companies, the medical device companies that are working unbelievably hard to try to respond to this and using basically all of the resources they have to respond to this virus. So there's a really important story there. I think another important story from a public policy perspective is how important it is for local communities, states and local communities to be able to respond to the specific needs on the ground in their communities. When Washington talks about Medicare for all and big Washington-driven solutions, it does not take into account the very different resources, the very different needs of different states and communities. And one of the things I think this has shown is how important that is in public policy making. There is a reason the founding fathers built our country and our system on a federalist model. And if anything, I think this COVID response and the ability of different governors to start to get together, maybe different communities can be opened up more, even if the whole state is not opened up all across the board. It's going to be a rolling start. It's going to be the same way that Ohio closed different sectors in a rolling manner. I think we're going to see it opening up. And I believe that's going to be very soon, because the American people, they're looking at all this data about 2.2 million potential deaths. And we're seeing now it's 20,000, 25,000, huge numbers still. But we don't close our country down for a normal flu season. And there are times when we have 50 to 100,000 people die from the flu. So we've got to be smarter about our response. We need to be smarter, like South Korea was, than Italy, in figuring out how to address this issue. And then finally, I'll close talking a little bit about where do we go through from here with health reform. If Bernie Sanders had been the nominee, it was pretty clear we were going to have a big debate over Medicare for all, or what? Well, the what is something that the Galen Institute and a group that we run called the Healthcare Consensus Group has been working on for several years, that really represents a new generation of health reform. And long before the COVID virus crisis, we had developed this plan. You can read more about it, healthcarechoices2020.org. healthcarechoices2020.org, and maybe Dan, you could put a link to that as well. To show you this path forward of a plan that would devolve power through the states to individuals. One of the other lessons we've learned here is when it really matters, you've got to clear out the underbrush of all the rules and regulations that are tangling up states and the healthcare system with so many rules and regulations that is making healthcare more expensive, less safe actually, and much more cumbersome. Now when Medicare is paying for a telemedicine visit, isn't it great? You don't have to go to a doctor's office where you likely, if you weren't sick already, have a higher risk of getting infected while you're there. The certificate of need laws that states have enacted over the last several decades, protectionist laws that keep the capacity of the healthcare system low and increase prices. If there are not enough MRIs in your community and you own an MRI, you can raise your prices. You begin to see the scope of practice laws, where people are not allowed to practice even at the top of their license because of protectionist laws on the books. A lot of those are being relaxed and even eliminated. And that's one of the things we're going to be doing, is working to deregulate our healthcare system, return power and control back to the states to open up their health sectors, give people more choices, and ultimately, and I'll close here, the goal has to be putting doctors and patients back in charge of healthcare decisions. Let your doctor decide, not somebody in Washington, not only what kind of health coverage you have, but the treatment you're going to get. We need to be able to move those decisions closer to the patient. A physician friend of mine told me once that if you listen to a patient long enough, they'll tell you what's wrong with you. But it's the doctor-patient relationship ultimately that has to be at the center that we have to get back to. So Dan, I'm going to leave it there and see if we have any questions.
Yeah, I just have a couple comments. The information about the Chinese in Italy, I hadn't heard that before. That was fascinating to me. I'm going to have to drop this bomb on you. I'm sorry. I apologize because a good friend of mine sent me something that I've just been pondering. I just don't really even know how to process it. It's from Bill O'Reilly. Quote, I believe the regime released a biological weapon upon the world that doesn't kill everybody, but kills enough, especially the elderly and ill-firmed. This was like Hitler thought the same way. He'd get rid of what he considered useless and rejects of society. And then he went on to talk about the fact that Trump was sending our largest 2 naval carriers to the Chinese seas. And I don't believe Bill O'Reilly is a great conspiracy theorist, but have you heard anything to that degree whatsoever in the medical field?
Well, there's absolutely no question that China is a bad actor here. They have basically stopped reporting deaths. We know, and how on earth was this virus contained just in Wuhan? What about Shanghai? What about Beijing? What about all the other millions of, thousands of cities in China that we don't even hear about that have millions of people in them? They are not being honest. When they first realized that they had a problem, that this was not only escaping but was very lethal and deadly, they actually destroyed some of the initial molecular material so that we could actually study it and begin to make viruses. So they are bad actors. I have read a lot about how this actually started. We heard it was the wet markets, these wild produce markets in Wuhan. That increasingly does not seem to be the case. A lot of State Department evidence suggests that yes, there was research going on. There are 2 laboratories that are near that wet market. One, in less than a mile, another one 20 miles away, that have been doing very, very high risk virology testing. And yes, we need to test viruses in order to be able to find vaccines. But if they were not careful and somebody wound up with some of the virus on their shoe and went to that wet market, it was a fertile ground for spreading this. I do hope that there are investigative journalists that really will dig into how did this start. There is a Pulitzer Prize to be won here. As we know, the Chinese scientists, the physicians who've come forward to talk early on about how risky this was, how lethal this virus was, how quickly it was spreading, many of them have disappeared. So it's very difficult to get this information. They have kicked out the Wall Street Journal, the Washington Post, New York Times. They've kicked out the reporters from major newspapers, but somebody needs to do the work of finding out how this happened, because there has never been a shutdown of the global economy that has done so much damage to so many people in such a short time in history. So we must learn how this happened. We need to continue to mobilize this unbelievable capacity we have in the United States to respond immediately to those that are sick, to be able to come up with the treatments, and to be able to vastly expand testing and produce the vaccine. We will do that, but we need to make sure this doesn't happen again.
Grace Marie, one of the things that's been really hard for me to watch is the Republican Party and their role in healthcare, and the fact that they don't seem to ever be able to come up with anything. Are they ever going to come up with a plan that we can take a look at for improving healthcare, or are they just going to keep giving us the same old complaining about what we've got now?
Oh, they spent so much time and energy on defeating Obamacare, and were it not for John McCain, we would have been on a very different track, I believe, to have been recovering and getting on the other side of this. But that's really what our Healthcare Choices plan is about, healthcarechoices2020.org, because we said after that failed effort in 2017, the policy community needs to step forward and come up with the next generation of health reform. We work with the Heritage Foundation. We've worked with the Pacific Research Institute. We work with the Heartland Foundation. We work with the American Enterprise Institute. We've got about 100 and some people and policy experts that have signed on to this plan. It also, many of the parts of it were adopted by the Republican Study Committee, which is the conservative caucus of Republican House members, House of Representative members, and they have a very similar proposal. It does not get any airtime because it is.
I haven't heard about it at all.
Yeah, I know, but yet there is absolutely a new generation of reform. It devolves power again away from Washington to the states, ultimately to individuals, reviving the market, making sure that the vulnerable are protected and taken care of, deregulating the market so that we can get more plans coming in. Ohio used to have a very vibrant market for health insurance. Not so anymore because of all of the rules and restrictions that Obamacare put on your market. So it's a lot of it is what we're seeing happening now in the health sector, but on steroids.
I think one of the massive things that's so scary to people is when you look at medicine and all the pharmacies and drugs, everything being made over in China.
Yeah.
How long is it going to take our country to be able to take that back?
I think that's going to be another one of the big changes. And I've seen people say, I'm willing to pay more in order to be able to have that capacity here.
Yeah, and one of the other things that's kind of been super interesting as we've learned about our hospital network more is just the massive number of small hospitals that are closing because they can't make it.
Yes,
What will happen to rural America and hospitals? What do you see in your crystal ball?
That is one of the reasons that we need to get Washington out of the driver's seat with the health sector. It's too local, it's too personal for Washington to try to run it from afar. So if you were able to have states have more power so that they can begin to have a more sensible market, then I think you'll be able to see those rural hospitals, maybe some of them repurposing to become specialty centers or doing something so that every hospital doesn't think that it has to do everything. You need to be able to have some hospitals that specialize, that become the place you want to go if you need cardiac surgery, that the place you want to go if you need knee surgery. There are ways those facilities could become really draws for patients if they have a physician or a team of physicians who know how to do a few things very well. So that could happen. It's not going to happen while Washington is in charge. One of the things that Washington has done is encourage consolidation of the industry. So you've got more and more bigger hospitals, more and more huge insurance companies, rather than having the more tailored regional solutions that really work for America. So that's part of our plan, is devolving power away from Washington so that we can have states figure out what are our resources, how can we repurpose them, who needs some extra help, maybe some tax benefits or some extra funding to be able to be smarter about how we're delivering healthcare in our communities.
I think what you're talking about is one of my favorite and most important subjects in government, and that's federalism.
Yes,
And
absolutely.
just how important it is. So listen, Grace Marie, if I was to make you the governor of Ohio, and maybe I had Mike Wilson as your lieutenant governor, and you found out that there were only 50% of the hospital beds or 42% of the hospital beds being used, and the doctors were basically laying off their staffs, wouldn't you in about 1 or 2 days be able to say, doctors, you can go back and do your thing?
Absolutely.
What is so hard about that? Is it just a conceptual thing or what?
It's just they've said we want to make sure the hospitals are available for this huge surge of millions of COVID patients. Well, it has not happened. And Washington and government always is a lagging is lagging in its decision-making power. But you're right, if the governor were making these decisions, he'd look at those several counties in Ohio and say, why do businesses need to stay closed there? Let's be smart about keeping our social distancing, maybe even wearing masks. If you're older and you've got compromised health, maybe you should continue to stay home. But we don't need to treat everybody the same and treat all of these businesses as though they are the epicenter in New York City. So yes, governors and localities should be able to make these decisions. Absolutely.
I see.
Yeah, and
Go ahead, Mike.
yeah, I wanted to chime in on that one if I could. I mean, understand that government has a bias in favor of safety on this one. Right, and that's something that you're going to see at every level of government, because deaths that can be derived like directly from a government action. We open the hospital. If you end up with even a little bit of a mini surge and there's a few people that can't get care, it is hugely visible, hugely covered by the media, very attributable to them. Right, but keeping it closed an extra few days, well, you were already closed. It's hard to quantify that impact, right? And that's why I think something like restartohio.com is super important, because it shows people that we're ready to go through and do that. They need a little bit of a push. And thanks so much to Grace Marie and everybody else for joining tonight. I love some of the ideas that you had. I think we need to incorporate some of that stuff into our plan.
Wonderful, and thank you for what you're doing. It's just hugely, hugely important. And I think that showing the public support and having people have a place where they can go for information is vitally important to restarting Ohio and restarting America.
Mike, instead of a little gentle push, do you think maybe we could maybe make it a little bit more of a shove, maybe? Or
I think if they don't start listening, some of that's going to happen whether you or I want it to or not. The number of people that are protesting outside the State House seems to be growing on a daily basis. There's a budding groundswell here, and we can do this in a smart, controlled, and safe fashion where the public's going to end up taking matters into their own hands. And that's when we do it in a way that could potentially increase risk going forward, when we wouldn't have to do it that way.
So we work closely with the Buckeye Institute, and they've got a really big audience. You might want to talk with Ray Hederman and some of the other folks at Buckeye to help push out the information that you're providing.
And Greg Lawson will be here in about a week, I think, talking to us. Well, listen, I just want to give you both a virtual round of applause, and thank you for one of the most interesting sessions we've done. And so to Mike Wilson and Grace Marie Turner, thank you. I just wanted to end our subject tonight with the story of a guy I believe who was an empowered guy. Bill Withers, you may be familiar with him. He recorded several major hits, including Ain't No Sunshine, Lean on Me, Lovely Day, and Just the Two of Us. Withers won 3 Grammy Awards and was nominated for 6 more, despite the fact he only worked as a professional musician for just 15 years, if you can believe that. He was inducted in the Rock and Roll Hall of Fame in 2015. This is what Bill Withers had to say when he was inducted. He said, "You got to figure I was in my 30s when I started playing music. It's not like my whole life was wrapped up in this entertainment thing. I started building houses, bought some tools, a truck. So there's no rule that says your life has to be just about one thing. You have to have a certain personality. I really don't have the personality to do this all the time. I'm not that outgoing. I'm kind of shy. I'd rather hide. I've never danced. I hid behind the guitar. So it's all life, as long as you're doing something that's important to you." The weirdest thing for me, Withers said, is I walk around all the time in Los Angeles. Nobody really knows who I am. I couldn't convince some ladies in Roscoe's Chicken and Waffles it was me. That's a true story. So come over here. I come over here to the Cleveland Hall of Fame to be inducted tonight. I'm going to go to dinner with Paul McCartney. I'm going to be ducking the paparazzi. I don't have to do that stuff. So this is just a big switch for me. Normally, I just go to Home Depot and try to get back before Judge Judy. Thank you for joining us tonight at EmpowerU. Bill Withers passed away on March 30th, 2020. Now, to all of you who joined us tonight, you go out and have yourself a lovely, empowered day. Thank you.